back to the channel. So this is Dr. Pragati. Let me introduce our one more doctor. This is Dr. Priyadarshini. Hello.
Hello.
This is Dr. Sunil Richardson.
Hi.
Today we are doing a program where we will be shooting few questions to Dr. Sunil Richardson, which are the most frequently asked and also funny questions that we usually get on our YouTube channel for all the videos that we post. So let me start with the one that we came across while we were going through the questions asked in the YouTube channel. So this patient was asked it, can you make me look like a movie star with face makeover?
Hi. So I don't think this is a very funny question because we actually can improve facial aesthetics very significantly. This is because by getting the facial bones and by contouring the nose, the chin, the cheek, the malar bones, we can actually get better harmony among the facial structures. We can make the facial proportions much better, and a golden facial proportion, a golden proportion gives that much more facial elegance. So I think the question is valid. And a lot of our patients were able to take you a few rungs on the aesthetic ladder, if you may want to say it that way, and without giving a blanket rule that okay, every single person we're going to make you into a movie star. I won't be right if I say that, but I definitely can say this. With the help of the surgeries, with the help of face makeover, rhinoplasty, genioplasty, the gamut of surgeries that we do here on the face, we're able to augment facial aesthetics significantly for our patients. And I say again, significantly with hardly any risk, right? So, do we have another question?
So the next one is a popular question and does make it in a hilarious category. Is the person dead or alive after surgery?
Yeah, right. This absolutely is hilarious. And I think there's not just one question or one person asking her these questions. There are probably hundreds of people there.
Even when we go live,
I know. Now look here guys, surgery is done when the patient is sleeping by giving anesthesia. No one is dead. They just sleep. And while they sleep, we perform the surgeries and then they wake them up, right? Otherwise, we'll be out of business or we'll be in jail. If all our patients are not waking up, I mean, that's ridiculous. So guys, please understand, every patient wakes up. We've not had any misfortunate incident till now. That's because there's a very rigid screening protocol. Our anesthesiologist and their team, they select the patient, they make sure they're fit for anesthesia, and only then the anesthesia is given. So, you know, a plane has to be fit for a travel. You just can't take the patient for anesthesia straight away. So please don't ask this kind of questions again. Every patient that you see in the video, even though may look like he's dead, but actually alive and is doing very well, right?
Breathing through ventilation.
Absolutely, right.
Will there be pain during surgery? Will it hurt, or the patient will know what all is happening?
Yeah, so you know, when you do a surgery means wielding the knife. So you have to make a cut, and whenever you cut the body, either the skin, the bone or whatever, we have nerves that supply, you know. Therefore, when you pinch any part or anything, you feel. So there will be a feeling of pain. This is the natural human process for any animal also. So what do we do basically? We are giving medicines because of which that pain is masked. So there is a pain, obviously, we mask that. So when the patient is in a general anesthesia, they don't feel anything because they're sleeping. When they wake up, we give them blocks and we give them injections, we give them medicines. So that makes that they don't have pain. So to answer your question correctly, do they have pain after surgery? It's mostly no, because our medicines are taking care. So that's why during surgery they're sleeping in general anesthesia. There is no pain during as well. So it's a no for all the part of the questions. Yeah, it's hard to believe, but it's a no. Right. What do we have next?
So the next question goes like, can an asymmetrical face be corrected without surgery?
Okay, so yeah, this is a common question which is being asked in different forms, you know. Basically, the patient there is trying to find out if we have the magic wand. But unfortunately, guys, we don't have a magic wand here. We might have to suggest surgery as a last resort but still it could be surgery. You know, as physicians, as when we train, we've been taught that surgery is the last option. It's not the first option. If nothing else can solve a patient's problem, then surgery is the last option. So when you have a problem, let's say an asymmetric face, sometimes it can be solved without a surgery by simply giving, for example, fat injections or by using fillers. Is that a permanent solution? No. Is that a temporary solution? Yes. But that's not a surgery then. You want a permanent solution without surgery, without injection, without anything, well then we are not the right people to come to. We won't be able to do that kind of a miracle here. But with the help of a surgery, yes, we can give you the so-called modern day medical miracle, which we keep doing for a lot of our patients. We not only change faces, we also change lives through changing those faces. Okay.
So one more question is, they see our live videos or videos that we upload and they're like, blood is required or what, so much blood loss is there.
Very valid question indeed. Yeah, when you see our videos, you know, because we are showing our viewers, we're showing our subscribers exactly what happens. We don't have a filter. We don't have a mechanism by which we delete some stuff and then show only what we think is appropriate. What I mean to say is, you get to see the surgery as it happens. You get to see the anesthesia as it happens. And obviously there's some blood loss. You know, when you go for war, there's some casualty. So likewise, in surgery, there is some blood loss. But, you know, a body is such that unless you lose a significant percentage of our blood in a particular short time, the body makes it up. You don't have to give the patient blood. Hence, blood transfusion, that is to give blood to the patient, the blood that's taken from another patient or from a blood bank, very, very rarely happens here. I won't say it doesn't happen, because we do some major cancer cases, we do some major hemangioma cases, we do some major craniofacial cases, and in all those cases, it's mandatory that we start with the blood reserved. But now talking about rhinoplasty or a jaw surgery, no, you will not need blood. So that's a very relevant question, I think, that the patients are wondering, oh my God, there's so much of blood being lost.
Like surgery is done, we need blood.
Yeah, so that's not true, because you know, our body, like for example, an average healthy guy or girl, like one of us, will be having about 5 to 6 liters of blood. That's a lot of blood. So if you lose, let's say even 200 ml, no issues. But if you're going to lose 1 liter, then you got to think of getting some blood transfusion. So I hope that explains to our patients.
Most often we're putting saline, so all
Yeah,
that
correct.
goes in the pipe is a saline.
So the saline also basically increases the volume of the blood, so to say, because it dilutes it. It still looks red. Yeah, and so that probably gives them an idea as to, oh my God, there's a lot of blood loss. But no, you don't have to worry about blood loss at all. Okay, what do we have? Do we have some more time? Yeah.
Yes, sir. The next question goes about the consequence of a face makeover surgery. So they want to know whether it will have a stark impact on, say, whether their passport or any official documentation in terms of the change that
Yes.
makes.
So recently we have uploaded a video on the New York patient, like lot of
correct, lot of changes, I know.
Like how will he go back to New York?
So well, if you have to realize that thumbprint, fingerprint, these are the most common identity used today, and they look into your eyes and the interpupillary distance. These are really the two main things they use for personal identification today in the world. So even though you change the face a lot, it's not going to be a big hassle as far as passports are concerned. Having said that, yes, a few of my patients have had issues, and so we've given them letters with documentations. We've said, okay, this is how the patient came to us, and this is what we've done, this is what his problem was, or this is what we've done, whether it was a facial feminization procedure or whether it was for another reason. So whatever that is, we will give you documents. We will give you a cone beam CT scan CDs before and after, which you can keep for your record. I've also had a few patients, who have been troubled at the airports by the machine that beeps a lot, because a lot of metal inside the face. And I think there's no need to panic even if a situation like that happens. You'll just have to tell the authorities that, look, I had this major surgery, I have a lot of metal in my mouth, I have a lot of titanium, a lot of plates, a lot of screws, and then they just check and then leave you usually. But if you panic, then they would probably, want a higher official to look into the matter, and that might delay some time, and maybe in a worse scenario you might miss a flight, but otherwise it's not an issue. Having said it, I also do, you see a lot of our patients are not elderly people, they are youngsters in their late teens and 20s and all that. It might be a nicer idea to have a new passport in a few months or few weeks, in a few years time, so that this is your face now, So I think I answered that, okay?
Yeah, and the most asked question is, where are you located? Where are you located?
I agree.
Do you
And what is the
have
cost?
branches? Cost.
Yeah, correct. So the three most common questions, let me try and answer that, and we'll probably call it a day for this video, right? So the most common question, where are we located? So unfortunately, guys, we're not located in any major metro in India, at least for the moment. We are in a very, very small town, but very, very beautiful place, and it's right in the southernmost tip of this large country of India, in a small town called Nagercoil. It's very close to Kanyakumari, the land of the Tri-Sea. So to get here, you'll have to come from Kerala or Trivandrum, God's own country. It's not far. And this is just like heaven if that was God's own country. So it's an amazing place, but it's a little difficult to come to because we're not in Delhi, or we're not in Mumbai or Bangalore. We had plans to have branch in Bangalore for a while, and the pandemic is actually making some delays. I also used to work out of Muscat, which is near Dubai. I still have a license, and also some other countries from time to time. But with the current pandemic, I think the best way to get these kind of treatments done from us is here at Nagercoil. We will come up with a video in case we move our location, in case the pandemic, the second wave comes down, when things become normal, or so to say better, we will be in other locations. So at the moment, guys, we don't have a branch anywhere else, even though I used to work out of different cities. There is just one place that we're working out regularly. You can come over here, you're most welcome. Take appointments on WhatsApp, because again, it's remote. And the next question is the costing, right? What is the cost? Now guys, cost depends on what we do. There is no blanket cost for any procedure, because every procedure varies. So rhinoplasty can be 30 minutes, can be 2 hours, 3 hours, jaw surgery 45 minutes to 5 hours. So it's very hard for us to give you one rate. So what usually happens is we have rates for different procedures, and based on the inflation, these rates also go up and go down, also based on the COVID scenario. All our rates went up a bit after the COVID pandemic, because of the PPEs that we have to use regularly, because of the so many investigations that we have to do, because of separate protocols that have been instituted. And again, we have an NABH accredited facility here. NABH is National Board of Accreditation for Hospitals in India. It's the best board that gives certifications for hospitals. So we have the basic level here. We don't have the highest level of accreditation, but we still have a basic level, which means that our services are all at par with the best quality. Safety is of paramount importance, and all of that is taken in care. And also, when you say NABH, it also means our rates are systematic. But I request you all to send us, we have a WhatsApp number that we have a couple of doctors trying to answer. So if you can send us your pictures with your queries, try to give us as much information as possible. Traditionally, I like to tell this to a lot of our patients, so the first step is to see a patient, right? So inspection, you want to see a patient, and then you do palpation. So this is what we taught: touch the patient, see the patient, touch the patient. After that is what we go and do auscultation, meaning you use an instrument to feel and to see what's happening. And then we do investigation. In the investigation comes the scans, the x-rays, the blah blah, everything else. Now when you have a WhatsApp consultation with us, we're basically in level 5. I don't get to see you, I don't get to touch you, I don't get to do auscultation, nothing. So you have to understand that it's not the normal way of functioning, and therefore you have to give us as much information as possible so that I don't make a mistake. Not intentionally, but I don't want to make a mistake and make you travel a lot of miles, or disappoint you for whatever reasons, or maybe give you false hopes in some other cases. So it's very, very essential that please give us pictures. We are not going to use those pictures on YouTube channel. That's a common query everybody asks. Oh doctor, will these pictures be confidential? Absolutely. So only when you come here directly for a procedure, whatever that is, we'll take your consent, and then of course we will use it in our social media or for a channel or something else. So I think I've answered that as well. Do we have anything else major that
Looks good. Most of them.
we've done all of it?
Yes.
Okay, so I hope this video is useful to you guys. We've tried and answered some of the common questions with the intention that these questions don't keep coming back to us.
At least this might help a few people.
I know, because we have a lady, Philomena, just taking care of these questions, and if more relevant, pertinent questions come, then we'll be more happy to answer, and those questions will have more value rather than we go back and forth answering the same questions, right?
And she helped us give these questions to
Absolutely, yeah. So we're getting, I think, about 500 questions. It's a huge number of questions every day. We're still trying to go and answer each and every one of these questions. Please understand that there's a delay from our end because we are also humans. We are not a huge team. And yes, we will reply. And I hope this was useful. And give us information about some of the other questions that you'd probably want us to answer. We will pick them up, and then in another video, we will try and answer them for you. All right?
Thank you so much, sir.
Thank you.
Thank you both of you for compiling the list of questions, and I really hope this was useful. Thank you once again.